Hey guys, welcome back to Friends and Enemas. This week's episode is a little different than our previous episodes. I am interviewing a woman named Rachel who has a background of becoming an LPN after struggling through school and eventually transitions into a registered nurse, but that's not what we're talking about today. I wanted to bring her story to light because I've honestly never spoken to someone who wanted to tell a story like this, and I think it could help a lot of women out there. Rachel is going to be telling us a hard story of her postpartum psychosis, and I wanted to give you a little bit of a content warning before continuing the episode. This episode contains subject matter which some may find disturbing, uncomfortable, or may be a trigger. Content is not limited to, but does contain graphic descriptions and self-harm. Please take care while listening. Hey guys, welcome back to Friends and Enemas. My name's Lindsay. I'm your host today, and who do I have with us?
My name's Rachel.
Tell them how we met.
Well, we just met.
We just met. Actually,
Lindsay's just met me, but joke's on her. I've known her for forever. So I've been a nurse. Let's see. I graduated in 2015, I think. How many years is that? 9?
Oh, yeah.
Wow.
Coming up on 10.
So my way into nursing was kind of like very similar to yours. I, from a very, very, very young age, wanted to be a veterinarian. I think 14 or 15, I got hired at the local veterinary clinic that did large and small animal to be a kennel tech. And I thought it was like the best thing ever. And I was making like $5.50 an hour. And I remember I was so stoked. And I told my Mimi, which is my grandma, and she was like,
my grandma was my Mimi.
No way.
Yeah.
Oh, that's precious. Okay. Well,
just another thing, another tick.
We are becoming best friends. So I told my Mimi, and I remember the face of shock on her because she's so elegant and like proper, and she's like, "You're gonna be cleaning up dog poop, and you're only making $5.50. Like,
you're like,
have some higher goals, girlfriend." And I was just like, whatever. Like, I'm so happy. And so I did kennel tech for a little while, and then I was able to like move into being like a veterinary assistant. But same as you, like I very quickly realized, like, oh my goodness, none of these people have lives, and I don't know if I knew I wanted to have a family. I think I did. Mm-hmm. But like I just saw that like with every female veterinarian, it was, and to this day, it's still the same way. So my father-in-law is an equine veterinarian. So he just does horses.
Oh, wow.
And I have yet to meet a female veterinarian who is able to successfully balance work life. Mm. And even like at that young age, at like 16, 17, their husbands are saying like, it's me or your job. And I'm like, this is not what I want.
Damn.
Like,
yeah, right.
And like, they weren't wrong. Their husbands weren't wrong because like they were getting treated, their marriages were not successful.
Sure.
On a whole level. But that, it wasn't just like a one-off. It was like the theme.
Yeah.
And it's hard to put your soul and passion into something that requires like so much of you. And Absolutely. Then also like you're dealing with such high stress, and you know, clients can be very difficult to manage, and the heartbreak of the profession and all of that, it's just not very conducive for a family life.
Yeah.
And so I was like, I'm not sure that I want that. And then I ended up going on a missions trip to India, and I was 17 when I went on this missions trip. And I'm the oldest daughter of 6 kids.
Oh, wow.
So I'm the second.
Big family.
Yeah. So I'm the second oldest, but I'm the oldest daughter. So like I'd been around kids my whole life and never really thought about like, hey, I like kids, because that was just like my life. And then I went to India and was around like all these kids in these like super remote villages and stuff. And I was like, oh my goodness, I love children. Like I am obsessed with these kids. And that's when I decided I was already at like the junior college, because I did like dual credits.
Oh yeah.
Because my mom's like, yeah, I'm not teaching you math. Sorry. you can go to Ivy Tech and you can get dual enrollment. So that's when I decided, like, I want to be a nurse and I want to take care of sick kids. And I want to do so I want to take care of sick kids, and I wanted to be able to do like missions trips for nursing and stuff like that.
Okay, guys, we're about to get into something pretty touchy. Rachel's going to dive into her postpartum psychosis, and I'm just going to let her take the wheel. I don't know if that's
the mic.
The mic, yeah, the mic.
So I am a survivor of postpartum psychosis, which is not a fun title to hold, but I'm grateful to be able to say that I'm a survivor. A lot of people don't know what postpartum psychosis is. Even like as nurses or providers, OB, all of those things, we really only like learn I remember learning about it in LPN school.
Yeah, I do too.
And I think we all learn the same story. It's the mom in Texas who, the mom in Texas who shot her 5 kids, I think it was.
I think I heard the same exact one.
Like I've researched it enough that I'm pretty sure everyone learns that exact, like that's the story unanimously told.
Yeah.
And so like it was a 5-second conversation in nursing school. There was no like, here's what it actually is or anything. It was just one of those situations where you're like, oh my gosh, that's so awful. How horrible.
Yeah.
Like monster mother. Like there's no education for like what does it actually look like in real life, or like how do you help these people. So anyway, very few people even know about it, but the people who are familiar with it usually have only heard of it after a tragedy of a baby dying at the hands of postpartum psychosis. I'll say that because after experiencing it, it's very hard to say that mother murdered her babies.
Right.
The end result is the same, but it's not done out of the same context. So usually people, if they've heard of it, it's been because they heard of a tragic story in the news and of a baby dying because their mother killed them, or their mother killed multiple children. And all of the stories that I have heard in the news, the mother is painted in a very poor light. She was well known to the mental health community, or she had a history of drug abuse, or she was well known to police or something like that. And no one is like really looking at these moms at all. And even when they like interview family members and stuff, or like the husband, a lot of times wasn't present enough to help her. And so the things he's saying aren't accurate either because he wasn't there witnessing or playing enough of a role to see what was happening. And so what he's saying about the situation also isn't accurate. Mm-hmm. And so it's something that hardly anybody knows about. And it's thought to be very rare, but I disagree with that. I think it's actually a lot more common than we think it is, but we just have really horrible research, and these moms are ending their lives before they're being diagnosed. So it's estimated that like 1 to 2 out of 1,000 births will have postpartum psychosis. So it works out to be like 0.1% or something like that. Like, so you think like astronomically rare. Like I'm going to go my whole life and I'll never meet anybody like that. But what people don't know about, we associate postpartum psychosis and mom killing her baby, which is infanticide. Or it's also called filicide. I don't know where that comes from. But infanticide is when you kill your baby. So we think that those are synonymous. But what people don't know is that way more often than that being the outcome, the mom is committing suicide. Mm-hmm. And so I would argue, so suicide is the number one risk factor for death in the peri and postpartum period. So while you're pregnant and then in your postpartum period, wow. Suicide is the number one cause of death. by a long ways. And it's not well tracked because there's different parameters on like what is postpartum. So like how far are they following these mamas?
Yeah.
Is it 6 months? Is it a year or whatever? So we're losing whatever number of moms to suicide. We have no idea what number of those moms were suffering with postpartum psychosis.
Mm-hmm.
And that would have been me. My outcome would have been suicide. And I think that there maybe is a couple of reasons why it causes suicide. For me, it was the hallucinations. But I could imagine for a lot of moms, the process of having psychosis is really terrifying.
Mm-hmm.
And if one thing that's interesting about postpartum psychosis is that it is much different than other types of psychoses, like drug-induced psychosis or related to schizoaffective. And this is like a major thing to understand about postpartum psychosis. And one of the reasons why it's really difficult to catch is that it's transient. So you'll have moments of lucidity and then go into full crazy. And so it can be really challenging to catch for that reason. I know for myself that when you're having delusions or something, depending on what those delusions may be, and then you come back to reality and you're like, oh my gosh, like I really thought those things were real or that I could do that. How on earth would my brain be capable of thinking that I need to kill myself just to protect my child? So I think that suicide occurs because of that. Just like if you're in a moment of lucidity, realizing like I need to protect my family from me, or like I can't fathom the fact that like I was able to have those thoughts.
Yeah.
When you're in a delusion or hallucination. And the other, like what occurred for me was my hallucinations were telling me that I had to sacrifice myself, which that's also how babies are killed, is because that mom is experiencing a hallucination from, more often than not, it's like from a higher power. So God or some other, whether or not they were spiritual or had any religious beliefs whatsoever, it's something important enough that this hallucination is telling them that to protect their child, they have to do this XYZ, which results in drowning or, shooting, however. But if they don't do it, something really bad is going to happen to their child. So they have to do it to protect them. So it's done out of an act to protect, and they're in a hallucination, and they believe that hallucination. And so kind of like, my husband and I got pregnant with our son Russell when I was working in the NICU, and he was very much intentional, and we were very, very, very excited to be pregnant. And I think that there's also a misconception with postpartum psychosis, or I don't necessarily think that other people believe this, but I think that if you're a mom in the postpartum period suffering from postpartum depression or potentially postpartum psychosis, that you may believe like that you didn't actually want this child. And that's not necessarily like that. Maybe that was true. Like maybe you didn't plan the pregnancy, but that's not correlated to postpartum psychosis, and it has no bearing on postpartum depression whatsoever, which I'd like to mention that like those are two very different things. Postpartum depression is very, very serious and needs attention and treatment right away, and can have devastating results if not treated. But postpartum psychosis is not the same thing. Yes. Postpartum depression can get bad enough that it develops into postpartum psychosis. But it's almost like like you have two diagnoses. They're not one and the same.
Okay.
We were so excited to be pregnant with Russell. We did not plan on having biologic children in our marriage because I had my thyroid taken out. I had to have my thyroid completely taken out 10 years ago. It was right before we got married. And I learned enough about it, like struggling with managing my thyroid hormones is really hard. And I learned enough about it that it's really hard to maintain a pregnancy because like a lot of women will not have any thyroid problems and then they get pregnant and their thyroid's like insane. And that results in miscarriage or even sometimes stillbirth. And oftentimes it can be late in your pregnancy. And so after like learning about that, I'm not that kind of person. Like I'm not going to sign up for something that I know is going to break me, especially because, you know, the nature of I just love babies, right? Like hand me a block of cream cheese swaddled in a blanket and I'm going to love it forever.
Yeah.
That's literally what being a NICU nurse is. And I was really grateful. Tyrell, my husband, was on board with adoption right from the beginning, which felt even more empowering to go that route because that's not super common, I don't think. Like maybe I think adoption is viewed oftentimes as like a last resort. But with the chances being high for miscarriage, especially late in pregnancy, I can't do that, you know, and I don't know how those mamas do it and survive that.
Yeah.
Especially then, like, if they're having multiple losses, like, I don't know how you go through that. And I knew I didn't want to even, like, chance it. And thankfully, we got married young. Same as, like, our story. Like, we've both been married, like, 10 years now.
Yeah.
And I think how old are you?
32. Had to think about it.
I don't really know how old I am. I think 32 or 33. What year were you born?
92.
Okay, I'm 33 then.
I did that too, actually. I was like, wait, what do you mean? Yeah, for sure.
Because I turned 30 when I was pregnant and like going through stuff.
Yeah.
And it's like it didn't exist.
It's like, yeah.
And so now all these years past don't count. Like they don't count and I don't know where I'm at.
Yeah.
So I ended up, I got really bad, when I had my thyroid taken out, I got really bad periodic limb movement disorder, which is like restless leg syndrome, but on steroids. And I didn't know until, like we got married like 6 months after I had my thyroid out and lived together for the first time then after marriage. And my husband's like, you're like leaving bruises on my legs because you're kicking me so hard. It's not like the no one knows what this is. You know, like restless leg syndrome where they're just like rubbing their legs together. It's like full like kicks. Or like my leg will like be up in the air stretching or something like that. It's like it's pretty aggressive. And so like I had a sleep study done and it was like very, very severe periodic limb movement disorder. And there's like few treatment options for it, but it occurs once you're in sleep, not like how restless leg can happen if you're just being still.
Yeah.
And it was disrupting my sleep enough. Like I only slept for 3 hours during the sleep study and I had over like 10,000 movements or something like that.
Wow.
And wasn't getting into any like restorative sleep.
Oh, wow.
And so it's like, oh, maybe that's why I failed school so hard. Like totally dive bombed because I'm not sleeping.
You can't sleep, yeah.
But anyway, went through like different medication trials for that. And the side effects never outweighed like none of them ever actually worked that well. At one point I was on like 1,200 milligrams of gabapentin.
Oh, wow.
And like I would write a sentence and like there'd be words missing in the sentence. And it was like, okay, nope. And then meanwhile, my primary care is like, you need to be on clonazepam. Like clonazepam's the only thing that works.
Yeah.
It works. We know it works. There's no side effects, like immediate side effects, right? It's effective, blah, blah, blah. I come from a family of addiction. My father's side of the family, everyone who he has known or been related to growing up, highly involved in drugs and alcohol. And I know that I have that tendency in my personality. Like it's just something you kind of know about yourself, right?
Yeah, I can relate.
You're full throttle.
Yeah.
And it's all or nothing. And I think part of it's like growing up with trauma is because it's a trauma response. Like when you look into the different types of emotional abuse and the outcomes that it produces in children, one of them is like you can outrun anything bad if you keep going fast enough.
Yeah.
And I think that correlates to the addiction propensity. But so I knew that about myself and I was like, I'm not going on a benzo. And it took me a couple of years of trialing these other meds finally was like, okay, like the
I'll
lack
try
of
the
sleep
benzo.
is going to lead me to some type of an addiction because this is crazy.
Right.
So I went ahead and went on clonazepam, and I coupled it with Cinemet, which is for Parkinson's.
Oh, okay.
And that combo was perfect, like phenomenal for me. But then between my thyroid and, like, you learn in nursing school, right? Like, no benzos in pregnancy, right? So nope, don't do it. I didn't even think about the Cinemet, but I was like, those two things combined, like, no, I can't get pregnant.
Yeah.
Ended up that we consulted with maternal fetal medicine, which I'm not sure. Are you familiar with?
Mm-mm.
So they abbreviate to MFM. So from here on out, I refer to them as MFM, just because it's easier. But they take care of all of the really high risk pregnancies. So oftentimes they become involved after a mom has already been pregnant, and then something is seen on ultrasound, and they get referred to MFM to follow the high risk pregnancy. So I actually worked really closely with them because usually they're following the pregnancy for a sick baby, not a sick mama. But all of my cardiac babies would go through MFM.
Okay.
And so oftentimes mom has her primary OB because she's already been established with them and then gets referred to MFM. Well, you can consult with them if you have something that puts you at a higher risk for pregnancy, to say, like, how's this looking?
Yeah.
You know? So we did that, and they have like a high risk pregnancy pharmacist and like all this stuff, and went through all my meds. It was very thorough. And they said, we can manage your thyroid. Like, it was nice because they validated, yes, we keep your thyroid in a completely different range than when you're not pregnant.
Yeah.
And they draw labs like weekly, because it changes so fast in pregnancy. But it was nice that they validated and acknowledged that, like, that does cause miscarriage because it affects your progesterone, I think. They said they were fine with me being on clonazepam. So I go for it, pop off, but you cannot be on Cinemet, and you can't be on it for like at least 6 months before getting pregnant because it affects the absorption of folate. Like I don't think your body's able to absorb folate, or very little, and folate is what's responsible for like neural tube defects and things like that. So it was something I had to get off of, and I had to be off of it for 6 months before we could try. But we were so stoked that like we could
There's an
try,
option.
and I was like, sweet. And I think that because we just never like got our hopes up for that option, it was like really exciting.
Yeah.
And so I had to titrate down on the Cinemet. It took a while because it was like my legs would get bad, and I'd be like, I got to go back up a little bit and then back down. And it was insane, like so crazy that when I finished, I got off Cinemet on a totally random day. And then when I calculated out 6 months from that day, it was our 7-year wedding anniversary. Oh. Okay, you tell me that's not meant to be, okay?
That's cute.
And we'd already had a trip planned to Puerto Rico for, I don't know if we had it planned yet, but we knew we were going to celebrate because we didn't have kids. We were, this, that, and the other. And it was just nuts that it worked out to be the same day, like the exact day.
That's cute.
As our 7-year wedding anniversary. And I was ovulating.
Oh.
And it was like,
it's like meant to be.
It was so cool. So cool. And the women in my family are fertile myrtle. So, like, you get looked at sideways and you're getting pregnant. And so we go to Puerto Rico. It was wonderful. It was so exciting. And I got pregnant right away. Mm-hmm. And I came home.
Fertile myrtle.
Yep. So the point being is that, like, becoming pregnant was very intentional and something very exciting. And so I had some medical trauma during pregnancy. But I don't want to like stick on that too much because it's not a prerequisite for postpartum psychosis.
Yeah.
And so pregnancy was really hard, but there was a finish line, and that was delivery. And once we got, like, delivery was amazing. It was like, I remember the nurses like being in awe of like how it was just like, I just like powered through, and I was like, yeah, I've been suffering since like the moment of conception. Aww. And this is the finish line. Yeah. And like, I'm so excited to be here because now everything's going to be fine. Yeah. Everything's going to be amazing. Joke was on us. That wasn't even like the warm up. That wasn't even pre-gaming it. It was like a sip of water before the flood. A couple days after having Russell, who's now 2, almost 3, the end of January 31st, he'll be 3. A couple days after having him, I started having really horrible nightmares. And they were related to like the medical trauma that I'd gone through in pregnancy. And so it was like, okay, this is like PTSD. And when I was at the end of my pregnancy, I was like, I want to be proactive and have a postpartum therapist set up just to make sure I have that in place if I need it, because postpartum therapists are like if you need help, too bad, so sad. Like, yeah. See you in 6 months maybe, or also we're not even taking a wait list. Good luck.
Yeah, exactly.
So I was like being proactive with it. So I had a appointment set up 2 weeks postpartum with this lady who specialized in postpartum, and also specialized in like some other things that were related to what I went through during pregnancy. And so I was like, perfect. And I remember when the nightmares started, I was like, it's going to be okay. Like, I'm going to go through, like, I'd never seen a therapist before. She'll help me deal with this, blah, blah, blah. And then like the nightmares were getting worse and worse very quickly. And they were very scary. Like, I was waking up covered in sweat, very scared. And Russell was sleeping in his bassinet in our room. And I remember like feeling so confused, like just very simple conversation I was not there for, not understanding. It was like not even going through the same part of my brain as what conversation would normally go through. And I remember telling this therapist, her name's Angela, I remember telling her that, and she's like, oh yeah, that's really normal postpartum. It's, we just went through a pandemic, all this. And it's like, dude, I like transferred into the NICU and started a whole new part of my career during COVID. Like, it's not related to that. Yeah. But she was the expert. And then after establishing care with her, she tells me that she's actually a trauma expert as well. Okay. And I don't know if have you ever heard of lifespan integration?
Mm-hmm. I have, but you can tell them if they don't know.
Lifespan integration, I'm going to give it a really bad perspective because the way it was used on me was insanely inappropriate. I know of people who have used it in conjunction with other types of therapy, and it has been helpful, but I don't know of anyone who's used it exclusively. The concept of lifespan integration is, and correct me if you know more of this than I do, because I
barely know about it. I just briefly know because I saw it online once.
Okay. I think it's trash. So unless you're in lifespan integration therapy and it's working for you, great. Otherwise, run away from it. The science isn't there. And any trauma therapist who's like specialized in EMDR or anything like that will be like, that stuff is cuckoo. Mm-hmm. This therapist referred to it as timeline therapy. And basically, you create a timeline of your memories. So she asked me for all of my memories from pregnancy that I had. And I gave them to her. And I remember her saying, like, don't forget to include the good ones. And I was like, I don't have any. And I think I gave her like 18 memories. And I worked hard to find 2 good memories. One was when we found out that Russell was a boy. And so we knew he was going to be Russell Eugene. And then the second one was when my little sister, I was very sick in pregnancy, and my little sister, who was 9 at the time, just did everything she could to like cheer me up. And it was like this really sweet memory. But otherwise, everything I had was a scary memory or a bad memory from being sick in pregnancy. And so what they do is they create this timeline, and lifespan integration is meant to be used on the lifespan, right? Mm-hmm. Hence the name. It's not appropriate whatsoever for acute trauma or anything near acute trauma. The purpose of it is like if you had a bad trauma or grew up in trauma and your brain is stuck at a place traumatically at 6 years old, they're trying to go through those memories that you have and then connect you to current time. So the way it starts out, the therapist will read you your memories, but they start out by saying, today is such and such day, it's this time, we're at Angela's office, I'm 30 whatever years old, and for me, because my trauma was during pregnancy, she would have me say, I'm not pregnant anymore, Russell is X amount of weeks old. To try to tell my brain, I'm not in that trauma anymore. And then she'd, like a metronome, read off these scary memories to me. And you have to acknowledge every memory. And if you don't, like, she just keeps berating you with these. And so I want to preface this by saying that she was not practicing appropriately. So my experience with lifespan integration obviously isn't how it was intended, but I've researched it a lot, and it's not really the most beneficial thing as a therapy option. But it makes a lot of sense. It makes a lot more sense in the context of using it if you're an adult and your brain is stuck at a traumatic moment from childhood. Yeah. To bring it to the present. But if you've just gone through acute trauma, I wasn't thinking of these memories that she forced me to bring up. Like I had to work hard to give her these memories of like trimester 1, trimester 2, whatever. And now she's berating me with them. And I remember like being on her floor in her office, sobbing hysterically. She wouldn't give me tissue because like you're not allowed to, like you have to cry. And so I'd be like snotting everywhere, like covered in snot. And at this point, like I'm out of it enough that I'm not driving. So my husband's taking me, or my mom, or whomever. Because I don't want to call it catatonic, because that's not, like, what would you call, like, catatonics, like, friend, little sister. Yeah. Like, so despondent and detached from myself. And just, like, not there. Yeah. So I'm being taken there, and she's promising that she can help me. And I don't know anything about trauma. Yeah. I knew nothing about trauma. And so I'm trusting this person who is an alleged specialist in this area and continues to promise me that she can help me. And she's just abusing me. But I didn't know. Right. And I was desperate to get better.
That makes me sad for you.
And I would have done anything. Like, you could have told me to do anything. And I would have done it. And I wasn't ICU nurse Rachel anymore who could research stuff. And, you know, I was struggling to make a bottle with formula. And so I am delirious enough that, like, I'm not able to do anything typical of what I would be doing. Yeah. So I'm going through this torture that she's doing. And, like, I remember the smell of her carpet because I'd be on the ground, like, in the fetal position, crying so hard as she's just reading all these bad memories to me and sobbing. And if I didn't acknowledge her, because like, when you're in that place, you completely leave your body. Yeah. Like, you're not there. And she would, like, shake me to acknowledge her because she won't go on to the next memory until
that does not seem like an appropriate way to help you.
So it's not appropriate. Like, it's not the way lifespan integration is intended to be used anyway. But then also it was not used in the appropriate context whatsoever. Like, even if she had been doing lifespan integration appropriately, that was not the appropriate context to use it in. You don't ever use it for acute trauma. Yeah. I know this because since going through all of this, I actually found the founder of lifespan integration. She's still alive, and I messaged her and pretended to be a nursing student doing a research project. And my project was a patient who was myself, and said, like, would this be
appropriate.
Would you use lifespan? Absolutely not. Absolutely not.
I just got chills.
Never would you do that.
What a smart little way to find out. I like that.
So devious.
Gotta know what you need to know.
When I like needed to hear it from, because like when you go through, like that was secondary trauma.
Yeah.
And when you go through something like that and you're like questioning yourself, like you need to hear it from the source. Like, no, this person did abuse you.
Yeah.
Like that was not right. So anyway.
Well, because you trusted the licensed professional to do their job appropriately.
Yes.
And you don't know what it is beyond you just being the patient.
Yes. And it's crazy because like Gus could educate you more on PTSD than she did. Like I remember asking her, like, why do I have PTSD?
Yeah.
Because I'd been through, like, I didn't have a plush life. I'd been through plenty. You know, like when I had my thyroid out, it wasn't cancerous, but it wasn't like a quote unquote emergent thyroidectomy because it was so convincing that it was cancerous. They wouldn't even biopsy it. It was obstructing my airway like almost 40% or something like that. That's how big it was.
Yeah.
And I was just like, I'm 21, living out in North Idaho by myself. And I'm like, okay.
Yeah, you'd been through stuff.
Like,
so.
I remember it was like no big deal. And I remember the surgeon being like, do you understand what I'm saying? And I was like, yeah, like it's got to come out. And it was like no big, like I was like, okay, let's do it.
Yeah.
And so it was like, it was really frustrating because I just fought this like physical battle of pregnancy and like fought it really well. And then now it's this mental battle and like, why? Why did that happen? Because I've been so strong my whole life.
Yeah.
Was it just because I wasn't strong enough mentally? And that's why this happened to me. Like, was I that's what I believed, was that I was just not strong enough mentally. Because I had never known anything about trauma. And I remember asking her, like, what causes PTSD? And she's like, we don't really know. Oh, really? Hello, amygdala.
It's kind of in the name, but.
Like, hello, hippocampus.
Yeah,
like,
exactly.
Russell, my 2-year-old, could tell you more about PTSD than she did. Like, to, like, not even be, like, not even try to explain it, but, like, also just say, like, we don't know.
Right. I don't like that.
If I hadn't been in such a horrible state mentally, because, like, this is me going into psychosis.
Right.
If I hadn't been so out of it, I would have been like, what on, like, you cuckoo.
Yeah.
And I remember after every appointment, like, my husband would come in and I would just cling to him and cry. And she knows to some extent what she was doing to me because she would tell him, like, she worked really hard during the session. Like, she cried a lot and here's what's going to happen afterwards. And, like, I didn't get out of, like, the first time it happened, I didn't get out of bed for, like, a couple days and I didn't eat for, like, a week. And I remember Tyrell, like, reaching out to her and being like, oh, yeah, no, that's expected. Like, she worked really, and just, like, constantly reassuring.
Wow.
And he didn't even know the half of what she was doing to me because I knew if I told him, I knew enough that if I told him, he would be like, there's no way I'm letting you do that.
Yeah.
But I was so desperate to get better.
Yeah.
So the symptoms started relatively quickly after delivery with the nightmares. So that caused a lack of sleep. And then, so the symptoms of psychosis are delirium. So you become delirious, which is like when I was talking about like not being able to understand conversation or just simple tasks being really, really difficult for me. I remember, so Russell had a very bad sensitivity to formula. And every formula on the market, we went through everything. And it wasn't like a little bit of a reaction. It was like his spit up was, even though we were wiping it off immediately, was causing like burns on his face because it was so acidic. And so I was able to do hardcore research and find, this was before there was a formula shortage post 2020.
Yeah.
A while post, it was like took a while to hit the manufacturers or somebody closed for a contamination reason or something like that. There was a massive formula shortage, but this was prior to that happening. And so goat milk formula was not legal in the U.S. or not allowed or not something with something with it being, because it was manufactured in Germany. So somehow getting it over here there was something about it. And the AAP, American Academy of Pediatrics, did not recommend formula. They recommended against it because it's not fortified the same way as U.S. formulas are. But we all know that like Europe's standards are way better than U.S. standards. And so I was able to, so like at that time, the goat milk formula it was in German. I couldn't even read it. Like, it wasn't translated into English anywhere on the can or on the website. And I figured out how to get the information. And it's not like the ratios were not the same for scooping.
Oh, yeah.
Of like, you know, how you mix US formulas or whatever. And because that was something that connected in my brain to being a NICU nurse. Mm-hmm. Because in the NICU, we do a ton with formula.
Yeah.
We're constantly changing the recipe on formulas to make it higher calorie per ounce and all of these things. So that was an area where I felt very confident, and it directly correlated to my ICU brain.
Yeah.
To an old part of my brain that I knew. I went to the like extreme because like it was something that felt familiar.
Yeah.
And everything else was falling apart in my world. And so I was able to figure out how to mix the concentration to accommodate for the lack of like phosphate and vitamin D it was like a very negligible difference. I was ready for my pediatrician to be like, no, you can't be on this. So I was like, well, I'm mixing it like 1 plus or it was like 1 plus 0.8 or something like that.
Yeah.
To accommodate for the phosphorus. And it's not overdoing it on any of these other things. So I was like calculating all those stupid things out. You know, like you look at a formula bottle, it's got like all those, and knew that it was like within parameters, and was ready to like show all of my research in a presentation to the pediatrician. And she was just like, great, I'm glad it's working for him. But like my brain was able to do that, but I couldn't wash a bottle.
Yeah.
Or like the weirdest stuff. And
you would like hyper focus on certain things
that made sense to my brain before.
Right.
There was never a moment where I didn't love Russell.
Yeah.
I was obsessed with him from the beginning. And I think that's another thing that people think, and that can happen a lot with like postpartum depression and things like that, is that you can feel a disconnect between you and your baby, but that's not necessary. Like it's not
always the case.
Correct. And so like I was insanely obsessed with him. But at the same time, like I couldn't care for him. The symptoms of like the big symptoms of postpartum psychosis are, and this is true for a lot of psychosis, but delirium, delusions, and hallucinations. Hallucinations being the most extreme out of all those three. So it started with the delirium, where things were just confusing and I couldn't wrap my mind around very, very, very simple. Like I remember driving, like when my husband drove me back and forth to this appointment for the therapist, and just being like a car would drive and I'd be like, oh my gosh, like that scared me. Mm-hmm. Caught me off guard. If I had been driving, I would have wrecked. Or just like always being like scared when we were driving, because it was like so overwhelming for my brain.
Yeah.
So that was the first symptom. And then, but I was still pretty present for Russell, because he had to have, the way his foreskin formed, he had to have a partial circumcision to release. And then we actually had to have a secondary one because he didn't numb up. And so it distorted because you do for a circumcision, you do a nerve block at the base of the penis. Mm-hmm. And, well, he didn't numb up. And there's not a whole lot of space there. Yeah. And so you dump 2 mils of lidocaine into that, and it's all distorted. And you don't want to accidentally, like, you can't put it back.
Yeah, right.
And so the first one was very conservative, but you have to go through all the care of a circumcision afterwards. And then once it's healed, you do the second one. Mm-hmm. But obviously I'm going to choose that option versus like taking too much foreskin.
Yeah.
And I was great at that. At the diaper changes, at caring for his little boy parts post circumcision, because I knew that that was something I could do. I was connected to who I was before, and I knew how to do it. And it was complex enough that it required my attention versus like mixing a bottle doesn't, right? Or washing a bottle or whatever, going to the bathroom. Those types of things don't require that level of intellect or focus. That was within the first month of life. And so I was able to do those things and somewhat like fairly present for those. The first time I like can tell you for sure when I was having a delusion, and I know my delusions started prior to this moment that I'm going to share, but this is the only one that I can correlate to like a time frame.
Yeah.
I had this belief. So a delusion is a false belief. And oftentimes they're scary. And they kind of are like what's that called? Intrusive thought.
Mm-hmm.
But the way that they're different than an intrusive thought is that an intrusive thought is concerning to you. Like, it doesn't make you feel good. It's like maybe scary or alarming or causes anxiety or whatever. But a delusion is like I'm telling you the sky is blue outside. And I know that for a fact. And you're like, the sky is for sure black.
Yeah.
That's a delusion. Like you
feel at peace with your belief.
Yes.
Regardless of what it is.
And it's like foundational. Like there's no arguing about it. Like with intrusive thoughts, I feel like, because I struggle with them a lot since all of this, is like it's kind of like this constant battle in your brain versus like a delusion. Like I was very confident in my delusion, even though I didn't like it.
Yeah.
My delusion was that I was not safe for Russell. And I remember believing this pretty early on. And I didn't have a reason why. Like I couldn't. A lot of times women will experience a lot of intrusive thoughts postpartum. Like common ones are like if you're walking down the hallway, you're gonna like bump baby's head into the wall on accident, or like being really scared to go up and down stairs, stuff like that. Like, so those are intrusive thoughts. But this belief that I was not safe for Russell, but I had no idea why. It wasn't like I'm not safe because XYZ, or I'm not safe because I'm gonna do this. I just wasn't safe to be his mom, and he needed a mom that could take care of him, and I wasn't that. Didn't know why, but I knew that was true. And so the memory of when I can connect it to a time frame is around Easter. So April, right? That's Easter?
Yeah.
And so I had Russell January 31st, so February, March, April, so like maybe 3-ish months postpartum. My husband's parents were over doing some house projects. And I was in the basement of the house with Russell. And at that point, I was like not really ever alone. Like there was always somebody at the house helping. My mom came from Indiana for like 2.5 months or something, like 2 months, something like that, a long, long time. And then when she left, we're very close with my in-laws, and my mother-in-law was always over. And like, I just always needed help, but I never knew why.
Yeah.
I never knew why I needed help taking care of Russell. I just knew that like I couldn't do it, or I wasn't the right person to do it. Someone else needed to do it because he deserved better than what I could do. And then I would just stay in my room, haunted with like all of these terrible thoughts.
So your in-laws were over for?
They're helping with house projects. Okay. And so I was in the basement with Russell. He was sleeping in his bassinet, and I remember I had to keep myself awake because I didn't want to have a nightmare that woke him up and scared him. And so I was like crouched down on the ground, and the way the basement is like there was like a half wall between these two rooms, and there was a window on the other side. And the way I knew I was awake was because I could see the shadows of people walking by. And I'm sitting in the basement, and the way I knew it was like real life was because I could see the shadows from the window. And then I could also I could hear everyone's footsteps because it wasn't well insulated, so you could hear where everybody was at in the house. And I already knew for a fact that I was not safe for Russell. And then at this moment, when I'm hearing everyone's footsteps, I hear them all in the kitchen, the dining room, which is like right above where I'm at. And I can tell everyone's footsteps are all right there. Mm-hmm. At least I think I can. And I was doing this thing, it's called depersonalization, where the best way I can describe it for me is like I was watching a movie of myself, of my life, and I'm like I'm floating in the air above my house. And I can see everything that's happening, and I'm experiencing it, but there's nothing I can do to stop what's happening. There's nothing I can do to change. Like, I'm only an observer, and I'm outside of the house. The other way it felt was like I'm watching everything happen through a window and no one can hear me. Like, I'm pounding on the window as loud as I can and no one can hear me. And so that's called depersonalization, which that happens with a lot of mental health struggles, illnesses. It's not like if any kind of trauma that
can happen.
Yes, because that's how you survive. It's like a survival mechanism, right? And so I'm watching as a third party almost, and I can see, even though I'm in the basement, I can see my husband with his mom and dad on the phone with my mom and dad in our dining room talking about how I'm not safe for Russell to be his mom. But again, no one has a reason. And how can they create an environment where I get to pretend and feel like I'm his mom, but they have all these safety checks in place, and there's never actually a possibility that I could ever hurt him or do anything wrong, because someone's always like actually there, and like maybe they're pretending that they're doing laundry, but they're actually watching me to make sure Russell's safe from me. So I think I'm doing it on my own because they didn't want to hurt my feelings. They knew I loved being a mom. They knew I wanted to be a mom. They knew I loved Russell very much. Yeah. But I wasn't safe for him. So how do we let her think that she's doing it? Almost like how you would deal with a dementia patient.
Yeah.
That just clicked now.
Yeah.
It's like, yeah, almost like how you do, like, yes,
Yeah.
Sorry, go ahead.
No. Keep going. Sorry.
So it was like this grand scheme. Like, they were putting a lot of effort into, and I remember being like, that's so nice that they don't want to hurt my feelings. And that they want to make sure that, like, I can feel included. Because I also knew that I wasn't safe for him. Mm-hmm. And if there was the option for someone else to take care of him, I gave them the option. Usually my mother-in-law or my husband, at that point, after my mom had left. And so that's the first time I can put a state on a serious delusion. And I had that was a continuous delusion that I had. I had others, but one thing that's...
Just to confirm, that was not happening.
Correct.
Okay.
Not at all.
Just for the listeners.
Yes.
Okay.
No, nobody was doing that. No one thought I was not safe for Russell. I wasn't even appearing scary to anybody. Yeah. Like, no one was concerned. Yeah. They just, like, no one even... I couldn't verbalize what I was struggling with. Mm-hmm. They just knew I needed help, but no one knew why. And I didn't even know why.
I only bring that up because I've seen other stories, like you said, where the mother does something to herself or her baby, and the family is always like, we had no clue, but they had a thought, they have a delusion that they did know. Mm-hmm. That's the only reason I wanted to confirm. Okay,
and
keep
so
going.
With psychosis, and I think this is true for all psychoses, but for sure postpartum psychosis, one of the reasons that makes it so difficult to detect is that you can have what's called bizarre delusions or non-bizarre delusions. And usually the cases that are caught are women suffering from bizarre delusions. Because those are the women who think the FBI is bugging their house, or the CIA.
Like grandiose delusions.
Really like, oh wow, something's wrong. Yeah. People are following, like, the same car keeps driving by, but it's not actually the same car. So bizarre delusions are much easier to detect because it's obvious that you're cuckoo. Yeah. I was having non-bizarre delusions, which are very difficult to detect, especially because it aligned with a lot of postpartum intrusive thoughts. Yeah. So I remember telling my husband, like, I'm not safe for Russell. Like, I can't be his mom. He deserves a mom that will protect him and keep him safe, and I can't do that. And of course he's like, you're nuts. You're an amazing mother. Like, what are you talking about? Yeah. Well, now I can't trust you. Because you were just having a powwow with our whole families in the kitchen talking about how I'm not safe for Russell and how can we create this fake world where I think that I am. Yeah. And now you're telling me that you think I'm a great mom and I'm perfectly safe for him and all that. But I know for a fact.
Your mind is just working against you the whole time.
Yeah. So with delusions, the best way to help somebody is to validate what they're experiencing, but then check the facts. Well, you can't do that if it's a non-bizarre delusion, especially one that like kind of aligns with postpartum struggles. So immediately then, like, now you're not a safe person. I can't share these things with you anymore. And so that was April. I was still seeing Angela, and I was seeing Angela up until I was admitted, so I'll just leave that there. And she was just as abusive
the whole time.
Her abuse actually got worse. But at that point, I was also seeing a postpartum psychiatrist who was like the best postpartum psychiatrist you could have in our area of Spokane. And that's all she did, postpartum psych. And I will say that like she was a wonderful lady, but I was so far out of her scope of practice, it wasn't even funny. So I'm seeing these two people that I'm supposed to be, should be taking care of me, right? Not to mention, I don't think I mentioned this, but MFM followed me during my entire pregnancy. I didn't actually they were my primary OB, because I went into pregnancy knowing I would have to be followed by them. So I was like, why have 2 appointments? Or like, why have 2 OBs? What's the point of that?
Yeah.
I'll just see MFM. Big mistake. They're no different than, like, they see a lot of ugly stuff, right? They are detached. They're also used to seeing sick babies inside of mama, not a sick mama. And so I was a vessel that held a baby. And as long as that baby was safe, that's all that mattered.
Yeah.
My well-being was not part of the equation.
Wow.
And I remember going to my 6-week postpartum check and I really liked my nurse practitioner that I had with OB, and telling her all these things. And a lot of my story that I am giving, I don't actually remember. It's me piecing it together through chart notes and things that my husband, from other people. What I remember, like the memories that I have are like that delusion. My brain believes that delusion as a real memory.
Yeah.
And it's also remembered as like flashbacks. But like piecing together the actual, like how...
the timeline.
So like, not all of this might be 100% accurate.
Sure.
But it's close
what
enough.
you know. Yeah.
Yeah. And so I remember, like, I have the chart note from that 6-week postpartum appointment, and she documented the things I was struggling with and was like, cool, she's seeing therapy. Refer to PCP. She did nothing for me.
Wow.
Out of all of the OB providers, maternal fetal medicine, who is supposed to be the elite, they take care of high-risk pregnancy, they should know the most, should have known about postpartum psychosis, should have educated on postpartum psychosis, should have educated on any type of postpartum mental health, which they didn't. But like at 6 weeks, the documented symptoms that she put were concerning enough for postpartum psychosis.
Wow.
And I was open and transparent. As a society, we think that we do so much better for moms with their mental health now than we did, say, maybe 10 years ago or something, which is all a big delusion in itself, because the big thing that was implemented is that at well child checks for baby, there's a screening on there for mom to see how you're feeling and to catch postpartum depression and postpartum psychosis, or even just so the disorders postpartum are postpartum anxiety, postpartum OCD, postpartum depression, postpartum psychosis. So it's screening for all of those things. And if you had asked me before going through all this, like before being pregnant and everything, because I was a part of that world as a nurse and I saw those, and I actually helped a lot of moms when I got those. If you had asked me, like, if I'd struggled with my mental health postpartum, if I would have ever answered those questions honestly, I'd been like, heck no.
Right.
No way. Like, there's no way I'm telling anybody my business. Fix it myself, right?
Yeah.
That's how I do everything. Fix it myself. No, I answered to the absolute most honest you could, and it was the highest red flag you could answer. It's like, like, I don't know, 10 questions. Same as like the depression screening questions, right? The PHQ 9 or whatever. And
they didn't do anything?
So I remember my pediatrician bringing it up. So Russell had like quite a few visits, because you have a lot of well-child visits within the first like 2 or 3 months of life anyway. And then with his circumcision, or double circumcision, there was even more. And all of those, I'm filling out the same screening. And I remember his pediatrician, the first time bringing it up, she only brought it up once, even though my answers were the same then throughout the rest of his care. And I remember this because it was so offensive to me, and I wanted to punch her in the face. It looks like you're having a really hard time adjusting to motherhood. No, I'm just having a really hard time.
Right.
But I am not able to say these things for myself, right?
Well, because you don't know either. You don't know what you don't know.
And so I was like, yes, which that is a massive judgment. You're having a hard time adjusting to being a mom. Like, that's not...
It's not helpful.
No. And that's mean. Like, I wasn't having, I didn't think I was having a hard time adjusting to being a mom because I loved my son so much. Right. I'm having a hard time... Period. I don't know. I don't know what's wrong.
Right.
But like, something is really wrong. And I was like, yeah, but I'm seeing a therapist. And as soon as like she heard she was like, oh, awesome. Great. Oh, and documents that. It's not her problem anymore. Right. And that's the problem with these screenings, that now we think we're doing so much more for these mamas postpartum and their mental health. No, we're not. The ball is just getting passed around, and these moms are actually just getting lost. Yeah. Because they think that they're being reassured that, like, oh yeah, that's great, you're doing the right thing, right, you're getting the help you need, but you're not. Like, she didn't ask who was I seeing, if she had known anything about the type of therapy I was getting, she would have should have intervened. Right.
So what led to the hospitalization?
So as the delusions continued, I remember the date of my first hallucination, because it was the early morning after after our 8-year wedding anniversary. And I remember celebrating our 8-year wedding anniversary, and we were at home, I think, whatever we ordered, I have no idea, for food. And I posted on Facebook, because I was so insanely grateful. Like, I loved this baby so much, and I was so grateful for him. And my husband is like, any part of, I had the most support you could possibly ask for, more than anyone really deserves. And if you were to have taken one piece of that away, I wouldn't be here today. And he was the pillar of that. Mm-hmm. And we're now 3 years into this journey, and he has not stopped. Not once has he skipped a beat. And he has been nothing but my caretaker throughout pregnancy and all this insanity of postpartum.
That's awesome.
And neither of us were advocates for mental health before this. It's not like it was someplace we knew or familiar. Right. And so it's that's kind of a hard adjustment to your wife's fine and now everything's crazy. Mm-hmm. And you have no way to wrap your brain around it, and there's no time to stop and think about it, because it's just crisis. So I had done a post on Facebook for our 8-year wedding anniversary of a picture of Russell and Tyrell. I still remember it's the cutest picture of being I'm just, how happy I was and how grateful I was, and all of that is true. And then that night we'd gone to sleep, and Russell's in his bassinet next to my side of the bed, and Tyrell's sleeping, and I am sobbing because I am this massive burden. He now has 2 babies to take care of. I can do nothing for myself. He has to protect Russell from me. Mm-hmm. I am not just useless, but I'm a heavy weight. And I'm sure as a nurse you can relate to how difficult it is, or the ship of being a burden. You want to jump in it and you want to drown with it, yeah. Right? Because we're not burdens. We take care of people, and we aren't the person that needs taken care of. Right. Which, probably says a lot about what we went through to become nurses. Right. But just that like I knew I was never going to get better. Somehow I knew that. And I couldn't stand the brain that I was in. And I couldn't keep doing this to my husband. And I'm just crying and crying and crying. And out of nowhere, it's like 3 o'clock in the morning or something. Out of nowhere, this was my first hallucination. So this is the start of my hallucination. I was crying, not hallucinating. And then all of a sudden, Satan, the devil, is in the corner of my bedroom, just there, just appears. And it wasn't even startling to me. Mm. And like I am a believer. I have strong faith in Jesus. I've talked to Jesus a whole lot, but I've never talked to the devil before. Like you would think that would be like,
alarming.
Oh my goodness, like what are you doing here?
Right.
And I was just like, oh hey, what's up? Like no big deal. And so my first hallucination was auditory and visual. The way he spoke was very like prophetic, biblically sounding. And he told me that he acknowledged how much I loved my husband and my son. And he said that in order to protect them, I had to sacrifice myself to him. But if I didn't do that, that God had already given him permission to torture Tyrell and Russell for the rest of their lives.
Oh my God.
And like they would live for a long time. It's not like they would succumb to his torturing. He referenced Job in the Bible. I don't know. I know that you grew up with a lot of foundational
religion, Christianity.
Yes, it almost sounds like Baptist, but I can't remember exactly. So I don't know if you're familiar with the story of Job, but he referenced Job, and in the Bible, Satan wanted to test Job's faith in God, and basically say like he's not that cool, like his faith ain't that great, and God's like, go for it, throw your worst at him, it is like he won't break. So Satan was saying, like Job, God has given me permission to put them through everything, and they will die, like they will suffer the rest of their lives. But if I sacrifice myself to him, they will live prosperously for the rest of eternity.
Oh wow,
well,
that's a lot of weight.
It was a no-brainer. Right. I was like, amazing. Aww. I remember, like, to this day, and this is really horrible. To this day, I have never felt the amount of peace that I felt when he told me that.
Oh, wow.
And I know it's not real peace, right? Like it's...
Right, but you still felt it.
Because I was in so much distress, and he gave me the solution, and I was like, amazing. I didn't hesitate for a second. And he had all these, like, insane parameters for how I had to sacrifice myself. And the word was, I'm continuing to use the word sacrifice because that's the word that he used. But it's killed myself is what the essence, right. That's what it was. But he said sacrifice. And that's important to how postpartum psychosis is. It had to be on a mountaintop at sunrise. It had to be a peaceful experience. He referenced something else in the Bible of like when somebody is martyred for Christ, but they're so strong in their faith that they know that they're dying for what they believe in. And so I had to die to him in that same way, knowing that I was dying for the betterment of my faith or whatever. However you would put that in translation for him.
Yeah.
So it had to be a peaceful experience, like something that I was looking forward to. And it had to be, I couldn't be found. Like it couldn't be somewhere where someone would find me. And if someone did find me, it had to look like it was not suicide whatsoever.
Oh, wow. That's a lot of...
Yes.
It's a lot of rules.
And it could, part of the like peaceful thing was that it couldn't be traumatic. Like if someone found me, it couldn't be a traumatic finding.
Right.
Because it couldn't look like suicide. It had to look like a natural passing or whatever. And I've never thought about suicide before that. I don't know if I've already said this or not, and I'm sorry if I have. Prior to this, I didn't struggle with my mental health at all. At all. And I can say that with like a lot of authenticity or very genuinely.
Yeah.
Not like, I'm not trying to like gloat in that or anything, but like I did not suffer with my mental health. I had no diagnoses. I'd never self-medicated. Nursing is self-medicating, but nothing like that. And then, so I never thought about suicide. And for him to like have all this check mark of things that I needed to do as someone who's never thought about that, I'm not joking you when I say like I didn't actually have to think about it and the plan was in my mind.
Wow.
And I knew exactly how to fulfill all of those things.
Oh, wow.
And at this point, like killing myself was very difficult because there was people around. I was never alone. And for the first time, the next day, my husband was going to go fishing with my father-in-law. And that's an all-day endeavor. Mm-hmm. And so I was going to be home with Russell for the first time by myself. And so I was going to call my mother-in-law and say like, hey, I'm not feeling well. Like, can you come get Russell? She would have said yes, obviously. And then I would have, I was going to drive up to a mountain where we had been once before camping. And I was going to hike up to this mountain and wait overnight. Because it was like a 3.5 hour drive, only because it's like logging roads and like really takes a long time to get up there because you have to drive like 15 miles an hour. And then it's a pretty decent hike to the top of this mountain. And I was going to start a campfire, something that I love. Like, I love camping. I love being out in the wilderness. I love being out in the middle of nowhere. In the mountains in the middle of nowhere is my place to be. And so that is peaceful in and of itself for me. Start a campfire, love that. And then I was going to wait for sunrise. I was going to smoke a cigar, which I love cigars, and drink my favorite whiskey. And at this point, my psychiatrist had me on a high dose of benzos. And that is a bad combination. But resulted in the type of death that Satan told me I needed. Mm-hmm. And so I would have just passed away. And it's because of how rural it was. Likely a mountain lion or wolves or something would have gotten to me before anything else. But just for that to have been, like, I just came up with that. Like, I didn't even try to think about it.
Yeah.
Like, he's talking to me. Satan's talking to me. And I'm like, oh, here's what I'll do. And it was so empowering to be like, here's what I can do to protect my family. I love these boys so much. And finally, there's an answer for, like, something that I can do for them. Because my husband has done nothing but take care of me in the worst of this. And I love them so much. And I would do anything for them. But this is like a real way to guarantee that I can protect them forever. And I absolutely will do that. And I wasn't scared at all. I couldn't wait. I was like anxiously awaiting the next day because I was so excited for it. And like, I can't even describe the amount of peace it brought to me. And so one of his parameters was that I had to write a suicide note. And I don't remember what it said, but I remember that he told me what to write because it couldn't involve him at all. Like, I couldn't reference him in it, or Satan told me to do this so that you'd be safe or whatever. It had to be like a normal Joe Blow suicide note, if you will. Mm-hmm. And so I got up and went into my husband's office, and I was writing what Satan was telling me to write in this suicide note. And it was like, don't look for me at our favorite campsite. Like, don't look for me at all, whatever, a bunch of stuff. And then, mind you, like, I had been sobbing in bed before this happened. And, like, my husband's a heavy sleeper. Doesn't wake up for that at all. I literally, like, signed my name on the note. And it wasn't probably your average note because it was, like, all these, like, things that I loved about him and all these things that I wanted him to tell Russell about me because I no longer was like that. Like, Rachel's gone. Yeah. I'm not Rachel anymore. I'm not her, and I'm never going to be her. I've been overtaken by whatever this is, and she's gone. And Russell doesn't no one deserves this version of me, but definitely not this beautiful baby. And definitely not this husband that I just love so dearly. And so I signed my name. There had been no noise in the house. I wasn't making any noise. I was no longer crying. I hadn't been crying for a while. Russell didn't make any noise. He wasn't crying. It was completely quiet. And all of a sudden, Tyrell's in the door of his office. And he sees me and he just knows what's happening. Like, he knows that I was writing a suicide note.
Oh, wow.
And he just starts crying and like comes and grabs me. And I'm pissed. I'm so mad because you're ruining my plan.
Oh, wow.
Like, you're getting in my way. What am I supposed to do now? And like, because I don't know how long I have to complete this task before it's too late.
Yeah.
Or before like the offer is gone or whatever it is. And so I'm mad, like really mad. And he's like hugging me and crying. And obviously being mad is not the typical response when you're found in that type of position. And Satan's telling me, start crying. Like, telling me how to act as if somebody, you know, like, you can imagine how you would act if your husband found you writing your suicide note, right? So I'm sad and I'm scared and all this, that, and the other, and I'm so sorry and blah, blah, blah. And this is in like the very early morning hours, and I don't think Tyrell ever read the note. He still has it, I know, but I don't think he read it. I'm pretty sure he didn't, and it's hidden away somewhere. I don't have any desire to read it or anything like that. But that next morning, as soon as he can, he contacts my psychiatrist and my therapist, Angela, who both are like, well, she needs to go inpatient. Inpatient mental health care in Spokane is notoriously horrible. And I knew that through friends who worked there. And because I was in and out of lucidity, I knew that it was bad care. And also, it was so weird because I was lucid, but I also believed that I also knew I still had to accomplish this task, to sacrifice myself to Satan. Mm-hmm. So it was really weird.
Yeah.
Of like this like split of being in reality but still believing the psychotic episode. Mm-hmm. And I think that happens a lot in psychosis. I don't know, but anyway, I refuse to go inpatient, and I basically say I say to Tyrell, like, you put me inpatient, I'll for sure kill myself, like knowing what to say to make him not do it, because he, you know.
Yeah.
And I was convincing enough, like I had enough information to give him that he was like, yeah, you do have a lot of sources that say like inpatient care is not going to be good.
Yeah.
And a friend of the family who is a therapist back home in Indiana that works with children who have gone through medical trauma. She was kind of like part of our lives at that moment to try to like help navigate things. And she told him that like, if someone goes inpatient when they're not ready or it's not the right place, the result is not good. Mm-hmm. And so then basically my therapist was like, well, like, sounds like a personal problem. Like, if you're not going to listen, you know, like, she didn't care. Thankfully, my psychiatrist cared, and she was committed to keeping me safe wherever I was. So it was, how do we keep me safe at home? Okay, Tyrell's going to get all these lock boxes, because at this point, I'm on a butt ton of meds. Mm-hmm. I'm on an insane amount of meds, and every single one of them could end my life. Lock everything up. Anything that could possibly kill me, lock it up. And I remember, like, obviously guns and things like that are, like, the big items. And I just was like, you idiot. Like, that's not what I'm going to use to kill myself. I'm not saying that out loud.
Yeah, but
like,
you're thinking it.
Yeah. I'm like, I'm not, like, I can't hang myself. Like, that doesn't fulfill this task.
Right.
That doesn't follow the rules. And now I'm, like, on to plan B. Because enough of plan A was given away that I couldn't use that plan anymore. Mm-hmm. Satan told me like I had to find another plan, and I could not for the life of me come up with plan B. I was fixated that was all I was thinking about day and night. And now I'm on suicide watch, right? Mm-hmm. So like I thought I wasn't alone before. I'm really not alone now. My older brother quit his job and moved in with us.
Oh, wow.
To help keep us safe. You know, my mother-in-law is there constantly. My mom came back out. Like, I'm not alone at all. And throughout this process, people kept asking me, like, how do you feel about Russell? And I got so mad at that question because I'm like, I love him. But, like, that's the question. If you answer that question the correct way, which is, I don't love him, or yes, I do think about hurting him sometimes. That's what's going to get you help. Not, oh my gosh, I love him so much, but I want to kill myself.
Yeah, they're not.
That's not what's going to get you help. You make any indication that you're not attached to your baby, or you're having thoughts of anything towards your baby, you're going to, that's the highlight. That's the ticket. What am I trying to say? You know what I mean?
Yeah, I do know what you mean. That's what's going to get you the actual professional help that you've needed this whole time, but have not been granted because you weren't following the typical...
what the perceived. And so, and it would make me so mad because I did love him so much. And for people to, like, it just further enforced in my mind that there was nothing wrong with me because I loved him so much. If there was something wrong with me, I would want to hurt him. But I don't want to hurt him, so there's nothing wrong with me.
So what got you to that point where you were, what happened that made you have to tell somebody?
So when I realized I needed help, it was probably a month after my first hallucination happened. And I started, my nightmares, we thought we were calling them night terrors. We thought I was sleepwalking. They were actually hallucinations. So you can have hallucinations that occur during sleep, or mimic sleep. And when you're in that hallucination, like one of the indicating factors is that you're not able to differentiate between your sleep-wake cycle. That's a big thing for psychosis. And so I would start out with what I thought was a nightmare, and then I'd be sleepwalking for this nightmare. So there's 3 big episodes of that, 3 big hallucination episodes where that happened. I was on so many meds, and I was not sleeping. I was on, like, Ambien 15 milligrams. I was on Seroquel. I was on a ton of gabapentin. I was on Zyprexa, like...
a lot of stuff.
Prozac, 80 milligrams. Like, I have a ton of, like, 8 milligrams of clonazepam a day. I was dosed out, and I was not sleeping. That's a huge red flag.
Yeah. Because
I don't know a lot about the chemical changes that happen, like, leading to psychosis, but if medications that are supposed to work a certain way, like sleep, like hardcore antipsychotic medications or whatever, and they're not having that effect on your brain, something's seriously wrong. And that's another thing that was missed, is that I'm on all these sleeping meds, things to help me sleep.
Yeah.
And they're sedating me and making it so that, like, I can't walk and stuff like that, or can't walk well, but they are not stopping my thoughts. Like, my brain is still racing, and also they're not making me sleep. And I remember there's a message, thankfully my nurse practitioner had taken immaculate documentation, and there's a message that I had left just prior to, like, being admitted, saying, like, I haven't slept, I think I've slept like an hour in the last 3 days, because I was terrified to sleep because I was having these nightmares that then are now turning into, I was sleepwalking, I thought. Right. So the first hallucination I had in that respect was that I'd gone grocery shopping with Russell, and I left him outside when I was bringing in the groceries. And it's been a couple hours, I've fallen asleep, and he's been outside this whole time. And he's, like, I have no idea, car seat or anything like that. But all I know is that I've left him outside. And, like, I'm not grocery shopping, right? Like, I'm not showering myself. Like, I'm not doing this kind of stuff. So it's, like, totally out there on a lot of levels.
Yeah.
And so I, in this hallucination, get up knowing for a fact that he's outside by himself in the middle of the night, freezing cold. And I remember I, like, got up and couldn't even, like, hardly get to the door. Like, when I stood up, I, like, smashed myself into the wall or something because I was so drugged I couldn't like, walk very well. And by that time, Tyrell, like, comes to and is, like, realizing what's going on. This is the first time this is happening. So I crawl as fast as I can, get to the front door, but I can't unlock it. Like I was too out of it to unlock it. And Tyrell comes and I'm screaming, Russell's outside, we have to get him. And he's obviously he's like, no, he's not. He's in his bassinet. He's safe. He's fine. And I'm like, no, he is outside. And I'm like physically pushing him off of me. Like, how could you, like, you POS, you don't love our baby? Like, what is wrong with you? He's outside. Like, why are we in here? Why are we arguing about this right now? And so, now we know how to deal with those types of situations, which is don't leave the person having hallucination. But he didn't know. Like, it's not like he did anything wrong. And the only thing that would, like, bring me back was if you could prove to me that he was safe. So Tyrell went and busted it to go get Russell to come show me he's safe. He's right here. Mm-hmm. And in that time, I get the door unlocked. I'm in a T-shirt and underwear, crawling because I can't walk, screaming for Russell outside in our front yard.
Oh, wow.
And, like, screaming. Tyrell has to pick me up and carry me inside. And I'm, like, fighting him as hard as I can. And hallucinations, I remember really well because your brain categorizes those. Like, those are real memories for me.
Wow.
Like, that's a core memory to me now, unfortunately. So that was, like, one night. And then a couple nights later, this also correlates to some stuff that Angela was doing. Because she had Tyrell start doing timeline therapy at home.
Oh, my God.
At night for my nightmares. Because up to that point, I was having, like, the same recurring scary nightmares from pregnancy. Mm-hmm. So if I had whatever nightmare, her and I made a timeline for it. She emailed it to him. He still has it. And I was supposed to wake him up. Oftentimes he would already be awake because it was so hysterical. And then he would do what she did. And so then now I'm having hallucinations at nighttime. It was a direct correlation. It was like a day after she started doing that.
Oh, wow.
A couple days go by. The next hallucination I have is that Russell's up in the night and I'm like a normal mom. I'm consoling him at night. No one else is around. I'm that typical mom who is up in the middle of the night with her newborn baby who can't sleep, and I'm rocking him and bouncing him, and I'm frustrated because I can't get him to sleep. And I'm making a cup of tea. It was a cup of sleepy time tea, the vanilla flavor. And I have him in my left arm and go to take a drink in my right arm, and the boiling hot water spills all over his lower half and scalds him.
Oh, wow.
And I've taken care of burn babies before. And so I immediately call 911. Except this is all happening in real life. Mm-hmm. It's not just in my mind.
Oh, my gosh.
These are all things that I'm actually doing. So I call 911 frantic, saying, please help, my baby is burnt. My baby is burned. I need help, please. And it's like this, whatever. And then I am trying to, like, get tepid water on him, and I'm getting him undressed and all this stuff. Well, I hadn't given 911 our address or anything like that, so it took them a little while to, like, find us. And in that time, I had come out of the hallucination, which I thought was a night terror, and I was so proud because I was able to, like, reorientate myself to the moment. And I was like, okay, I'm getting better. Oh. And then all of a sudden, there's, like, spotlights in our windows because I had no idea I called 911.
Oh, my gosh.
I had no clue. So I'm just laying in bed, chill, super proud of myself, thinking that I'm getting better now because I was able to, like, wake up from this horrible nightmare and be like, no, everything's fine. So there's spotlights in the window. Mm-hmm. He is obviously Gus is going bananas because mm-hmm. we all think that somebody is breaking into the house. And I didn't think someone was breaking into the house. I thought that someone finally caught on that I wasn't a safe mom. Oh, wow. And they reported me, and now they're here to take Russell. So I go immediately and I grab Russell and I run and hide with him in the closet. And all of a sudden, like, your closet fluorescent light comes on, and there's, like, 6 big EMS whatever guys in my closet door. It's a big walk-in closet. And they're wanting my baby, and I'm, like, screaming at them, like, you can't take my baby, you can't touch my baby, you can't take my baby. I didn't hurt him. He's safe. I haven't hurt my baby. And thankfully, Tyrell, that situation could have gone much differently. But Tyrell was able to communicate enough with them to say, like, she's having a lot of mental health struggles postpartum. She's seeing a psychiatrist, all this. But she's been sleepwalking. And so they convinced me that they don't need to take him from me, but I have to unswaddle him so that they can see that he's safe and not harmed. Because somebody somewhere, they can't figure out, they were very, I wish I knew who they were so that I could say thank you for that. Because if they had taken me in, the outcome would have been completely different.
Yeah.
So they told me, they're like, someone in this area called and said that there was a baby hurt. Obviously, like, Russell looks so happy and whatever,
Aww.
but we're just going house to house to find out and make sure every baby in the area is safe.
Yeah.
And I'm like, okay.
Aww.
And so I unswaddle him, and I made him, like, turn the lights off because I was like, the bright lights are going to wake him up and stuff. And it was, like, just massive, like, change. Like, I'm screaming and hysterical, and then it's like, oh, yeah, I believe that. The dumbest thing ever. Like, who would believe that? And so that happens. And it's funny, looking back in my phone log, every variation of 911 you could possibly think of, I dialed before I got to 911.
Oh my God.
191, 119,
Oh, wow.
I don't even know. But, like, there was, like, 18 different call logs
Wow.
before I actually got to 911. So at that point then, so, like, everyone's being updated. My therapist, my psychiatrist, everyone's being updated. My meds are upped. And Tyrell's like, now it's like, okay, how do we Fort Knox it even more than we've already Fort Knoxed it? Everybody's, now that they know what, like, I'm kind of capable of in my sleepwalking, cell phones, keys, everything like that is getting put in the safe.
Mm.
And I don't know the combo for the safe. And I remember being like, I will not give you my phone because I can't sleep at night because I'm too scared to sleep. And I go on YouTube and I'm watching this, like, I remember I was watching Yes Theory. I don't know if you've ever watched them.
No.
It's, they've got a YouTube channel, obviously. And anyway, it doesn't matter. I hope they hear this. Yes Theory, you were with me in Psychosis. They do stuff like going to, like, the world's most remote village and, like, connecting humanity, basically. And it's, like, long 45-minute videos and stuff, and it was just very comforting. Or
Yeah.
I'd be watching documentaries or something like that. And I was like, I can't be alone. Like, I have to have that.
Yeah.
I can't be left alone with just myself.
Yeah.
And so Tyrell was like, okay, here's this old tablet that we haven't used in forever. It has nothing on it. The only thing he downloaded, or the only thing it had on it was, or the only thing it was connected was YouTube. And it was YouTube Premium, so that, like, I had a select amount of things to watch.
Mm-hmm.
So, okay, awesome. Like, she can't do anything through that, right? Well, that night, my hallucination was that we were camping at our favorite camp spot. Tyrell and I have always camped at this exact same spot, way out in the mountains. Like, you don't see anybody. It's amazing. And we couldn't wait to take Russell there. And it's right on a creek. It's called Independence Creek. And when we were pregnant, we would, like, talk to Russell about, like, going camping with him and how much fun it would be. And so in this hallucination, we're camping, and Russell loved the water, loved bath time, loved splashing in the water. And someone actually in real life had just gifted me one of those, like, sit-em-up activity seat things.
Mm-hmm.
Because he wasn't quite able to, he was able to support himself well enough to do that, but not sit up independently. And the creek, because it's so far up in the mountains, it's not very deep, and there's, like, often pretty big dry spots in it. And so Tyrell, it was exactly how it would have been in real life. It was supper time. I was cooking on the campfire, making supper, and Ty was off fly fishing further down where the river is bigger. And I was playing with Russell in his little sit-em-up seat, and his toes were just barely in the water, splashing, and he's giggling and squealing. And it's just like in that moment of that hallucination, I was like, this is everything I've ever wanted. And I was just, like, so overwhelmed with happiness. And the creek is very close to like our campsite, and you can like see it from, I had to go stir dinner, and it's like 10 feet away. And Russell's like on a dry island. And even if he could have gotten out of where he was, there wasn't any like deep water anywhere near where he was. Mm-hmm. He's not crawling, this, that, and the other. And so I can go walk 10 feet and start dinner. I turn around, and his seat was tipped over, and he was gone. And so I like run out into the creek, and I'm looking, and I can't find him anywhere. And so I start running down the creek. And there's this bend in the creek, and there's like a lot of down brush. There's like a down tree and all the stuff that is collected with it. And Russell is there, face down up under the brush. And I run to him as fast as I can, and I pull him out from under the brush, and he is limp and cold. And like the way hallucinations are insane, because like my body, like I can feel his dead body in my hands right now, like as if it happened for real. Mm-hmm. I know it didn't happen for real, but that doesn't change the way your body holds that. I can remember every scratch and every bruise on him. And I had to like bushwhack really far through these like really thick thorns, weeds, whatever, to get to like a cleared area off of the creek. And I get him down, and I immediately start resuscitation. And I, in my hallucination, am trying to resuscitate him for like 30 minutes before Tyrell gets back. And Tyrell gets back, and I'm just like, he's like, what happened? And I'm like, I'm so sorry. Like, it's all my fault. I drowned. I'm so sorry. And then it like cuts from that, and it was like obviously he had died. But then it's like the very next thing in my hallucination was planning his memorial. And like that's how it worked in my brain, the hallucination. And I was gonna like post it on Facebook, you know, Russell passed away, blah blah blah. Well, I got access to Facebook in my hallucination, which like if you were to hand me your phone and be like, hey, log into Facebook, I'd be like, yeah, right, I can't remember anything. Mm-hmm. In my hallucination, I got access. I like downloaded Facebook, signed in, remembered my password, and posted this status that said something like, please keep our family in your prayers. Like Russell drowned, and it was all my fault. I should have, like, it didn't sound right. Yeah. I should have taught him how to swim. I don't know why I never taught him. It's all my fault that he drowned. And this is like, I think like maybe 4:00 in the morning, 4:30 or so in the morning. And I have a lot of friends on Facebook from Indiana, which is 2 hours ahead of us. And so people are like awake and seeing it. And then, again, I wake up from this hallucination, and I'm able to reorientate myself. And I did go check on Russell, like, and saw that he was safe. And I was like, everything's fine. And I ended up sleeping, like laying down on the ground next to his bassinet and sleeping next to him, and just being like, wow, I'm so glad that wasn't real, because it was horrifying. Mm-hmm. And then all of a sudden, like, someone's knocking on the front door, and it's like super early. It's like 5:00 in the morning, and it's my mother-in-law. And people have been trying to call us, but our phones were all in the safe, so we didn't hear anything. And they had seen the Facebook. I don't know how it came about, but I think maybe one of our family friends saw it and called my father-in-law or something, and then no one could get a hold of us. And so my mother-in-law like comes racing over, and she's pounding on the front door, and she's like, where's R2 and Russell? That's my family nickname. Where's R2 and Russell? And she's like very upset sounding. And I wake up from all of this, and I'm like, he's fine. Like, I'm like sleeping next to him. I'm like, he's fine. Everything's fine. Like, I'm thinking that she's there to say that, like, my father-in-law died or something like that. And I keep asking, like, what's wrong? What's wrong? And she's like holding my face and like making sure that I'm okay. And then like she has to hold Russell to make sure he's okay. And she's just like tearful and like very scared. And I can't figure out why. And I'm like, what has happened? And she won't say. And then like her and my husband and my mom, who my mom was living with us, are all like whispering, and like it's like very weird. And I'm like, what has happened? Like, yeah. And nobody could tell me. And then finally it comes out what had happened, and I was like, oh my gosh, like, yeah, I had that nightmare.
So the Facebook post was real?
I really posted it.
Oh, wow.
And like tons of people had commented.
Oh, wow.
And I think I was like in shock about it, but I was like still so happy that I had like been able to reorientate myself and come out of the hallucination.
Yeah.
Or what I thought was sleepwalking. And it took me like a couple of hours to realize that. So when if I was ever on compressions in my career, I always used like, I bit my bottom lip as like a metronome. Mm. And that was something like I did in real life as a nurse. And I remember even in the hallucination, like I did that.
Oh, wow.
Like as I'm resuscitating Russell in my hallucination, I'm like, you know, and it took me a long time, a couple hours from all the adrenaline. I almost bit through my bottom lip during that hallucination.
Oh, wow.
Because I was biting my lip so hard, apparently. And that's the moment I realized how like real that was. And like, I think that they had found like the pillow, or they think they found the pillow that looked like it was in a really weird place and like didn't belong where it was at. Like, yeah. This is probably what she was like smashing on.
Russell.
And I realized like, even though like all of these instances are me trying to save Russell, had I done that to him, had I done compressions like that on him, I would have killed him.
Oh, wow.
And in that moment, I was like, take me anywhere.
Oh, wow.
I cannot be around my baby. Like now, like I am an absolute risk to his life, and I will not live with that. Find me help or I will kill myself. Not like Satan sacrifice, but like I will end my life to save him from me.
Yeah.
I will not live on this earth being a danger to him like that. And it was kind of challenging to find where the best place was for me to go. And we ended up driving to Seattle, which is like a 6-hour drive from where we are. And I went inpatient at Swedish Ballard. And it was really difficult because you go in through the ER. Like my psychiatrist wasn't able to get me a bed. So I had to go in through the ER and like literally just walked up and said, you know, they're like, what are you here for? I'm like, I want to kill myself. And so like everyone's like playing nice and everything. And Tyrell's been by my side like this whole time. And they're like, okay, like here's this wheelchair, blah, blah, blah. And then they like take me away and they won't let him come.
Oh, God.
And like, I understand that now, like I understand why that's necessary.
Right.
But like for me, like with my medical trauma and all of that, like to just be wheeled away. And it's like their psych room is like a legit psych room. And it's in the far back corner of the ER. And it's got a giant garage door as one of the walls. It's concrete everywhere else. I have to like get undressed in front of these people, and I'm just hysterical, screaming for my husband, and they won't let him back. Finally, like a psychiatrist like lets him back, and we stayed in that room overnight. And thankfully, they had a discharge and had one open bed for me.
Wow.
Upstairs on the psych unit, and yeah, that is how I got diagnosed and on the right set of meds. And it was still so much happened after that, because we really we left there really not knowing much. As they were like learning my story or learning about like what led up to it, which I'm sure like me trying to tell them what was going on was very confusing. They said that like that therapist that I'd been seeing was largely contributed to my psychosis.
Wow.
And I don't believe that anymore because I can't carry that hatred in my heart. I've forgiven her because anger is...
That's how you move forward.
Well, and it's like she took so much from me when I was not capable of protecting myself. And if I don't forgive her and I carry that with me still, then I'm choosing to let her continue to steal from me. And I won't let her do that.
Yeah.
And so I don't believe that she was responsible for my psychosis. I definitely don't think she helped it. But they kept saying that I had postpartum psychosis. This is the wild thing about postpartum psychosis. They kept saying that I had postpartum psychosis, and they would even like call and update Tyrell. He wasn't allowed to visit. Like, they don't allow any visitors. And it was a very good psych unit. Still horrifying. Still so terrifying.
Yeah.
And postpartum psychosis, blah, blah, blah. I didn't actually know this until like months and almost maybe a year later. I was struggling so badly after like being treated for psychosis and no longer being in psychosis. My PTSD was horrible. My brain was just awful. It was a haunted house. And that's when I started self-harming, not as a way to harm myself, but the best way that I could describe it is that it would, like, the chaos in my brain would get to a level of like a circuit board just flying off, like sparks flying everywhere. And my method of self-harm was burning myself. And it wasn't pain at all. It like immediately shut my brain down, and it was so calming. And the only thing I can like relate that to is like having an orgasm. That's what it felt like in my brain. And so it was like this level of massive anxiety and overwhelm and overstimulation and all of these things. And then I'd do that and it would be gone.
Wow.
And it would totally resolve. And that was a treatment mechanism for me for a very, very, very long time. And it was really effective. And it was really easy to justify because it made me a better mom. Because even in the, like, so I'm now 2 years out of being in active psychosis. And in the first year especially, I wasn't functional at all. Incidentally, our house ended up flooding, which catastrophically, which resulted in us moving in with my in-laws. The best thing that could have ever happened, because I didn't realize how much help I needed. I didn't realize how bad things were in my brain.
Yeah.
Because I just thought, like, if I can just get back to who I was before, everything will be better.
Mm-hmm.
Like, I know I can't manage being a NICU nurse. Like, I knew that, and I hated that, because, like, that was my identity before. I hate to say it, but it was.
Yeah.
If you'd asked me who I was, the very first thing I would have said was a nurse.
Yeah.
And I'm so glad that that's not where my identity lies anymore. But I thought I was nothing. Like, I had nothing. I can't take care of my son. I've spent my entire career taking care of other people's babies, and I can't even be a mom to my own baby. And I've missed, like, his first year of life. Like, I genuinely don't have memories of him from his first year of life. If I see a picture or something, I'll know the story behind it.
Yeah.
But I can maybe piece together some memories. Like, if I see a picture and the memory is my own, I'll know it for sure. It's a different type of feeling. And but like, it's like around Christmas, between Thanksgiving and Christmas time is when that starts, and it's not consistent with the pictures, even the ones on my own phone. And like, I don't have a video of him as a newborn, and like all those cute like baby grunting videos that mamas have, or like the baby like, I don't have any of that. And so that was all gone, and I was so mad, and the grief of that was overwhelming. And I didn't think there was any way to resolve that. And so then I struggled with suicidal ideation because, like, life just sucked.
Yeah. I think you went from postpartum psychosis to clinical depression.
Massive depression. And I didn't think I was depressed. I thought I had anxiety because of that aspect where the self-harm helped.
Yeah.
I was like, I want to kill myself because I'm so anxious. And it's like, no, I had major depressive disorder and I was massively anxious. But the primary diagnosis was PTSD.
Yeah.
And so I just thought, like, if I can just get back to who I was, things will get better. And so I didn't want some, like, nursing job that felt like I was just, like, just there to be a pair of scrubs.
Yeah.
Because, like, of what I'd come from. But I knew, because I still wanted that life as a nurse. I still loved that, and I missed that so much. But I knew, like, there's no way my brain can function. Like, I can't leave the house.
Mm-hmm.
Russell's crying puts me into, like, an anxiety attack. I have these panic attacks that come out of nowhere because I have, like, these random triggers that my brain is remembering that I don't know. And so, like, I know I can't do that. But, like, what's something that maybe still feels like it aligns with my passions of nursing but is obviously, like way lower on the risk scale of, like, if something goes wrong, someone's baby's not gonna die.
Yeah.
And I found a ENT surgery center that was looking for a surgery nurse who had peds experience, because ENT surgery does adults, pediatrics, all of it. And so it was a per diem job, and I was like, oh, that's perfect. So I started doing that. And at one point, I was self-harming to get through a shift.
Oh, wow.
And, like, I would totally be gone. Like, I'm going to be honest, like, it's not that, it doesn't require a whole lot of the ICU brain that I love to use. And so unless it was requiring a lot of focus from me, I was gone.
Yeah.
Like, I had no idea what was going on. The simplest things I could not remember. Like, literally, like, which fluids is someone's getting warmed fluid, someone's not, or, like, silly stuff like that. But like, a kid was post-op, and I caught a really, really, really rare arrhythmia. Well, I'm sure you know a lot about arrhythmias. Brugada syndrome.
Oh, and you caught it.
I was like, is that a saddleback? And, like, I'd never seen a Brugada. Like, I'd taken care of Brugadas because they're followed by, because usually you don't know that someone has Brugadas unless another person in the family has died as a sacrifice. Mm-hmm. And then, like, I think if they're under a certain age and someone dies of sudden death, they automatically test for Brugada syndrome.
Mm-hmm.
And so, like, I caught that on, like, the crappy 3.0 EKG.
Yeah.
And nobody believed me. And I was like, no, this kid's, like, crashed. Like, he wasn't coming out of anesthesia well and stuff. Anyway, it was, like, this whole big thing. And I, like, lost my marbles in the process of it. And, like, had to massively self-harm to get through that shift. And then I'd been concealing it from my husband. And then he found out, and, of course, then promptly attended my next therapy session with me, which at that point I was with the therapist who I have now. After being discharged from the hospital, they told me, you don't ever see this person again, Angela. You need to find someone who's, like, properly trauma-informed and does EMDR.
Yeah.
And I was very, very, very grateful to find the therapist that I have now, who actually specializes in, it's all under the umbrella of birth trauma. No matter any kind of trauma that occurs during pregnancy, after pregnancy, whatever, is, like, categorized under birth trauma. So she specializes in birth trauma and PTSD and medical trauma as well. She's actually properly an expert.
She's not Angela.
Exactly. Her website doesn't talk about how amazing she is, and that's how you know she's amazing, because she doesn't have to tell you how amazing she is.
Thank you for sharing your story. What is something that you want other people to know about postpartum psychosis that maybe not be out there, that maybe is not out there?
I want postpartum psychosis to be like a household term, the same way postpartum depression now is. And I want people to not be afraid to help moms, because if something feels scary or suspicious or concerning at all, I will tell you right now, as a survivor, as much as it would have sucked for CPS to be involved at that time, nothing would have been worse than losing my baby.
Yeah.
Like actually losing my baby. And I am extraordinarily lucky because of the support system that I had. Otherwise, like, I can't even, the stories that I've heard, like, there's a postpartum psychosis survivor support group, and it's like, oh my gosh, like, you guys haven't survived anything.
Yeah.
Like, this is horrifying. But being on the other side of it, if something feels wrong, the safety of my baby far outweighs whatever outcomes come from the trouble of getting CPS involved when maybe they shouldn't be involved. I'd much rather you err on the side of caution for that than anything.
Yeah.
So get CPS involved if you're scared, because a mama in psychosis is actually really, really hard to help. And the most important thing to that mom, I promise you, is her baby's safety.
Yeah.
Even if it sucks for like a long time afterwards. What made me start to speak about my experience and realize like how aggressively uneducated our healthcare system is, our obstetricians are. Like there's this, I don't like to throw out a bunch of numbers with this, but here's one that's like really fascinating, is only out of like a huge survey, only 80% of OB providers said that they knew about postpartum psychosis. Of that 80%, and this is a recent study done, of that 80%, less than 20% of them were ever educating at all about postpartum psychosis.
Oh, wow.
For two reasons. One, a lack of time, which is a lack of education, because if you don't think there's time for it, you obviously don't know the importance of it. Number two, a lack of their own confidence to educate on it. So it's both, it boils down to lack of awareness of psychosis.
I'm glad you're here to tell your story, because I think you're going to help so many people, not just women, men too, because I think spouses need to be knowing about this as well, to see signs for their loved one and to take it serious and to realize that it could escalate to something you never wanted to.
Yes.
So I could talk to you about this for days, but we are officially out of time. I'm so glad that I got to meet you in person and hear your story. Do you want people to find you on social media or an email to reach out, or no? Yeah,
that would be awesome. So I actually tried to follow in your footsteps of like starting social media for educational purposes. So I have like my handles made, but I haven't started making content yet. That feels like a massive...
It's scary, but you can do it.
I've done 2 TikToks.
Okay. You're well on your way.
I don't know about that. Well, I've got like 900 views on one of them.
See? You're well on your way. Tell everyone where they can find you, and I'll also have your social medias in the description, along with some links to further information and education about postpartum and postpartum psychosis.
Perfect. So my Instagram and TikTok, which there's not much there, is _inpatient_nurse.
Love that.
And then my email address is pagingnursepeters@gmail.com. And I love hearing back from people. My goal is to do as much of this as possible.
Yeah.
And my primary goal is to educate nurses first, because I think that's how to make the biggest impact. But ultimately, I want to be educating the masses.
Yeah.
And so as many people as I can share with, that's what I want. So if anybody has any events or anything like that where you think that my story would be fitting, or like nursing events, things like that, like I want to share my story. I want to help other women, and I want to protect them and their babies. So
I love that so much.
Yeah.
Thank you so much.
Thank you for giving me this space.
You're welcome. I can't wait for this episode to drop. And until next time, guys, bye.